Chronic kidney disease or CKD. Now, when we talk about CKD, we are referring to a gradual and permanent decline in our kidney function over time. Now, it does not happen overnight. It develops slowly as our kidneys lose their ability to properly filter the blood. Normally, the kidneys contain millions of microscopic filtration units known as the nephrons. Now, inside each nephron is a tiny cluster of capillaries called the glomerulus. Think of it as the biological filter. Now, our blood passes through this structure, allowing waste product, excess fluid, electrolyte to be removed, whilst the essential components like the proteins and the blood cells stay in the circulation. In CKD, this filtration unit slowly becomes damaged and start to disappear. I need you to understand that right now. Now, the two most common causes are long-standing diabetes and chronic high blood pressure. Elevated blood glucose can injure the delicate blood vessels in the glomeruli, while persistent hypertension places constant pressure on the kidney's filtration system. Now, over time, this results in scarring and permanent loss of functioning nephrons. When some nephrons are lost, the remaining ones initially try to compensate by increasing their filtration activity. Now, this process is called hyperfiltration. Now, for a while, this adaptation can keep our body stable. Now, this is why patients with early CKD may not notice symptoms right away. But as the disease progresses and more nephrons are destroyed, the kidneys can no longer clear the metabolic waste efficiently. Substances such as urea and creatinine begin to build up in our bloodstream, leading to a state known as uremia. As kidney function declines further, several physiologic problems also develop. Now remember, the kidneys lose their ability to regulate fluid balance. This may cause swelling and worsening hypertension. It is very important now. Potassium control also becomes impaired. What happens after that? Then it increases the risk of serious cardiac arrhythmias. Now let's talk about this one. Reduced production of erythropoietin also leads to anemia in this condition, and impaired activation of vitamin D contributes to bone and mineral disorders. Now we monitor CKD using estimated glomerular filtration rate or EGFR. Now, this reflects how well our kidneys are filtering the blood. Disease is divided into 5 stages, ranging from mild impairment to end-stage kidney failure. If kidney function eventually declines to the point where the kidneys can no longer maintain internal balance, patients may require renal replacement therapy, such as dialysis or kidney transplantation. We need to understand this. Chronic kidney disease or CKD is the gradual loss of functioning nephrons, and once those filtration units are gone, they cannot regenerate. It is very important now. Preserving the remaining kidney function becomes the priority in our patient's care. Want the best for you all the time. I'm going to see you soon. My name is Nurse Solomon.